getting injectables from like random people, or the señora that comes across from the border that's injecting who knows what into who knows where.
It is, and unfortunately in Texas for a while it's been kind of like Wild Wild West, where everybody and anybody was injecting.
People started telling me like, oh, don't go to this lady, she's doing this, and somebody got all kinds of bumps in their skin. It's kind of scary out there, you know? Oh, that's where I'm heading. Oh my God. I love my dad, but God damn it, I don't want to look like that. Will you still do it?
If it makes my patient happy.
Right?
Bitch, I said what I said.
Hi, everybody, and welcome back to Beautytainment Podcast. I am your host, Claudia Seves. You can find me at Vanidosa Beauty and Beautypreneur CEO. And I have a guest, guys. I'm super, super excited. I love the beauty industry. I love people in it. So I'm like super excited about this. This is Nisha. Nisha, hello.
Nice to meet you.
Good to meet you.
I'm excited to be here and share some beauty secrets.
Ooh. And so you are with?
I'm with DavidaMA Medical and Aesthetics, and we're actually a med spa dermatology practice that's located out of near I-10 near the Dominion.
And so if you guys know me and like you've heard my rants, you've heard a lot of my rants about getting injectables from like random people, or the señora that comes across from the border that's injecting who knows what into who knows where. So like having to talking to a professional that where they work at a med spa is like super exciting for me. So tell us a little bit about what you guys do at the med spa. Like, what are your main treatments? What do you love doing?
Of course. So I'm a nurse practitioner, so I pretty much do a lot of like dermatology treatments and the aesthetics, and we also do a little bit of laser. So we do a lot of things, say tattoo removal or vein removal, or just treating your skin conditions such as rosacea or acne. And then I love doing of course the injectable aesthetics, so the Botox, the fillers, and also like the natural, more natural approaches to fillers. So,
you know what? My favorite thing when, again, if you've talked to me about anything facials, I will say like vampire facials. I love vampire facials. But we were talking, and so apparently I'm fucking old, and they're not called vampire facials anymore. It's a new thing now. So, which is like really exciting, because not only are you getting your own plasma like injected into your face, so now you guys are adding something to the plasma.
Yes, so previously it was more PRP with microneedling, but now we're doing PRF. And the difference is the plasma-rich platelets versus plasma-rich fibrin. And so we're seeing through studies that this is actually lasting longer, and it's producing more elastin and collagen built up over time. So it's great for foundation, it's great for scarring, pigments, and so much more.
And I will say I had 2 treatments, and it was like my favorite thing. So to me, I've like, it's on my back burner to start getting Botox and the fillers and stuff. But one of the things that I've always talked about is the PRP or I haven't had the PRF. So I've talked the PRP just because it's your own blood. But again, my thing is, and where I'm from in California, like we had this lady, and she started doing the PRPs, right? But she was like this random lady in this random place. And then, of course, being in the beauty industry, you hear all these things, right? So like people started telling me like, oh, don't go to this lady, she's doing this, and somebody got all kinds of bumps in their skin and stuff. So I will say it's really important to go to the right people for this shit, because it's like, it's kind of scary out there, you know?
It is, and unfortunately in Texas for a while it's been kind of like Wild Wild West, where everybody and anybody was injecting. And definitely I recommend people like look into your injectors, see how long they've been doing this, see if they're credentialed, if they do continue education. You just don't want to go to, say, the cosmetologist down the street because she's giving you some Botox.
Because she also does hair.
Yes.
And then she's going to go ahead and inject your face. Like,
yes. And
that is nuts.
Right. And you know, their specialty is hair. So what do they know about like anatomy and the muscles and how they move, you know? So you definitely want to go to a medical provider that knows what they're doing.
And my whole thing in Texas is like, I love free enterprise. I love that people should do whatever they want. Where I think the line should be drawn is like where you're injecting toxins into muscles and then just kind of seeing what happens. And I believe the classes here in Texas are 2 days or 1 day for like the certification or whatever it is.
Yeah, it kind of depends where you go. Honestly, I've seen some 1 days, I've seen 3 days, I've seen 5 days. But just because you go to one class doesn't mean you're ready to get out there and inject people. I definitely recommend doing more hands-on training, shadowing, interning before you really get out there.
And then my thing is, okay, there's a difference between a 1 day class for Botox for me as an esthetician and a 1 day class for you as like a nurse practitioner. Like we are not the same. Like you can tell me what a muscle is, and then tomorrow I'm gonna be like, what was that thing? Was I supposed to inject it like at a 90-degree angle or like 45 or like what, you know?
Yeah.
And so I think it's really, really important to start going to professionals. And for me, not just injectors. Like I feel like when you go get injected, these people should know a little bit more about the aesthetic industry. And you guys should have maybe possibly lasers or do like not just injecting. I feel like just injecting isn't enough for me. If you're like gonna inject some stuff, like I really want you to know your stuff. You know what I mean?
Yeah, of course. We want to work from the foundation up. And so that's why we deal with skincare and acne and do lasers and aesthetic treatments hand in hand to help with those things.
And so another thing that we were talking about, which if you're an esthetician, you know how hard it is to treat acne. And again, we don't treat, right? We facilitate or whatever you want to call it. And I know you guys have some elevated acne treatments as well.
Yes, yes. So as a nurse practitioner, I'm able to see some patients that come in for their acne concerns. And the nice thing is most PPO insurances will cover acne cleansing treatments as like a procedure. So you would come to me, I would diagnose you with acne, and I would recommend this procedure. And so you would see our esthetician at that point, and they do a cleansing treatment, they do extractions if needed. We do inject Kenalog to help with more of the cystic or inflammatory acne.
Okay.
And then hydrate you and get you on your way. And we start off with, foundation. We start off with what are we using on our face? How often are we putting SPF on our face? Are we moisturizing? And then at that point, if we need to start introducing medication, that's where I come in.
And so that was my next question. Like, what is the difference? I know a lot of estheticians that do very well with acne. And, again, acne is like a spectrum, right? So I'm not talking about, I'm just saying acne in general, maybe very mild case of acne.
Of course.
Do you usually recommend somebody who has like cystic acne to go directly to an esthetician, or are we talking more about like this is a medical treatment because now it's cystic and now we're talking about inflammation and infection and stuff like that?
Yes, definitely more so the medical approach, so we can kind of combat it from all sides. So definitely starting off with that acne cleansing facial is not a problem, but starting off on, say, vitamin A, which a lot of people don't know helps dry up that extra sebum production.
You're getting that for free.
Yes.
Okay.
Y'all need to come in. But
get a real treatment.
Yes. So it helps kind of dry up all of that cystic acne, and then we can start going in and working on scarring and pigment, and that's when chemical peels and lasers come into play.
Do you guys also do the V peel or like something similar to it? Do you like a
yes.
D peel like that?
Yes. So we have different varieties of chemical peels, and so of course we start off and maybe might do like a little spot treatment, see how your skin reacts to it, because of course a lot of people have sensitive skin out there. So we have light peels all the way up to a dermal peel. And that one is kind of where, you may be a little red when you leave your appointment, but you'll start to notice the peeling action start like 3-4 days out.
Nice. I love that. I love a good peel. Like everybody needs to get a peel. Like everybody. No matter if your skin is perfect, you need a peel. Like you need a peel. But you also need to go to somebody that specializes in peels, and they have different varieties in peels. I just think like there's so many schools out there, especially like in the beauty industry, where they tell you can do all these things, but nobody really explains to you how to do it.
Yeah.
So I feel like, okay, if you're just cleansing and you're doing like a lot of fluff facials, everybody can do a flush facial.
Of course.
Right? But if you're really dedicated to clearing up acne, dedicated to resurfacing skin, that's kind of where the medical and the aesthetic stuff marry,
Yes, of course. And like talking about how the skin resurfacing, so we usually have, once we've kind of treated the acne and we're now addressing more of the pigment and the scarring, we'll suggest an erbium laser treatment, and that's a skin resurfacing treatment. So it kind of helps with like the acne that kind of looks like ice pick scarring, or helps with that deeper pigmentation. And it just helps with just tissue rejuvenation overall. So that repair process may take about 5 to 7 days. So I usually tell people like, hey, schedule this when you don't have a special event coming up because you're going to be a little red for a few days.
Yeah.
So we numb you for the procedure and we do the treatment. And I tell people you're going to leave here looking like a tomato, but it will not last.
Just know you're going to look ugly for a little bit.
But then you're going to love how your skin looks after.
And then, you know what? One of the things when I moved here, you know, because I'm from California, so I've only been here 4 years. And in California, I was doing peels and stuff, and I just did them whenever. When I came here, it feels like everybody's scared to do peels during the summer, but I feel like you can. Like you're not outside all fucking day. Like you're outside. You go back in your house, or you go to the mall, you go wherever. But you can get a peel during the summer. Or are you guys like? Do you guys advise your patients, your clients, to come in during the fall or the winter?
Not necessarily. I just tell them to take precautions, of course.
Right.
You know? So, like, I don't want you to go sunbathing after, obviously, because we want to protect that skin and make sure it repairs appropriately. So I'll just tell you, hey, if you can stay out of, like, extended periods of sun, better. And just make sure you're using SPF and hydrating and using moisturizers so we can make sure and protect that skin.
Right, and I feel like this is why you have to go to somebody that's a little bit more experienced when you're doing the heavy lifting for any skin health. Just because when you go somewhere else, it's like, oh, try this cleanser. And you have like 3 cleansers, especially with an esthetician. If you are a beginner esthetician, and again, it's fine because we all start somewhere, but if you're more of the fluff esthetician, chances are that person is maybe their back bar isn't really big. So they might only have 1 or 2 cleansers, you know, where with you guys, especially being medical combined with the aesthetics, you guys probably have a bigger back bar. You guys probably have a bigger retail for your clients where they can choose from. Is retail covered by PPOs?
Some of it, maybe,
okay.
yeah. It really depends insurance per insurance, and we do like a verification process to see
Beforehand.
But talking, you know, back to talking about the products, we do have medical grade products, and I tell people, you know, sure, the Ulta and the Sephora over the counter may help some, but if you're really looking for like some active ingredient, more potent ingredients, and for you to actually see the results in a shorter period of time, you need that medical grade skincare.
Yeah, and I feel like Ulta is good for like the 20-somethings.
Yeah.
Maybe if you're like 16 to about 22, it's great. Go to Ulta and get like, I mean, at that point, honestly, you can use like bar soap. It's fine.
Right.
But when you actually need things to happen, I think you need like a higher grade that's not available to the regular consumer.
Yes, for sure.
Right. And so you guys have different brands as well?
Yes, so we carry Elastin, which is an amazing skincare brand. We also have a Epionce, which is a more botanical base. So if someone's looking for more organic, it's still medical grade skincare, but it has an organic take to it. So a lot of botanicals in it. And then we carry Elta MD. So for like different types of sunscreen, we have tinted sunscreens, and we even have our own Davida skincare brand.
Oh, no way.
Yeah.
I didn't know that. That's so freaking cool.
Yeah, so we have cleansers, we have eye serums,
Oh, nice.
all the things. Yeah.
And so to talk about something completely different, why did you choose? So I have one of my friends is also an MP. She just graduated last year, like took all her tests and stuff. And so she is choosing to go into the medicine part of it. Not the, well, I mean, it's all medicine. But you know what I'm saying? Like she's going to see clients, and I think is it ER? No, it's not in ER. Long story short, she chose not to go into the aesthetics industry of the medical field. Why did you get into the field, into the aesthetics part?
So I actually do have an ER background. So as a nurse, I worked in the ER for many years, and then I eventually went back to school and I got my nurse practitioner. But being in that industry now for 10 plus years, and I still do work, you know, maybe PRN a few times a month in the ER just to kind of keep those skills going.
I could not, like after working in the beauty industry, I would not want to go to ER.
It's definitely, it takes a toll on you.
Yeah, it looks like it, man. That shit looks gnarly.
It definitely does. And honestly, after COVID, a lot of things changed. So my passion is definitely more functional medicine and more preventative, and more anti-aging. And I feel like aesthetics is definitely one of the niche in that area. So, you know, whether it's skincare or just preventing from aging. So like one of our products, Sculptra, we can start using it as young as 30. And what that does is to help prevent and help rebuild elastin and collagen. Because starting at the age of 25, we're losing elastin and collagen every year.
I know.
So.
And everybody needs to do something to their skin. I mean, like I said, you can use a bar of soap up until you're like 22, 23. But after that, like, you got to get serious about your skin.
Definitely,
You know?
definitely. And if we don't invest in it now, then we're trying to play catch up, say in our 50s and 60s, and it's harder to work the clock backwards.
Yeah,
then.
it is. It's better to be prettier for longer. Like, it's nice to be pretty, I'm sure, at like 80, but at that point, like, you got a couple years and you're gone. You're going to be pretty for 3 years and that's it, you're dead. But going back to why you got into the medical field, do you feel like this is as fulfilling as working in the ER, or is it like a different type of fulfillment? I know for me, making that switch from seeing clients to teaching, it definitely fulfills like a different cup for me. It fills a different cup for me.
Yes, definitely. So I like educating my clients, and I was very, very big on that as a nurse itself and onwards. So just teaching my clients, hey, what can you do for your skin? How can we prevent this in the long run? And it is very different. Like in the medical background, especially ER, I can help you with the situation, but it's almost like a Band-Aid till we figure out what's the root cause, right? So emergency medicine, we're more specialized in emergencies. So people that come in for like, well, my knee hurts for a year, I can't fix that today.
Right now,
But
here's a referral.
Exactly.
Yeah.
So a referral to go see the specialist. So a lot of people kind of leave upset because they're like, well, you didn't fix my problem. But coming into this industry where patients are coming to you with their problems of, hey, I want to take care of this, or I've noticed my face is sagging more and stuff like that. And when we're able to do a treatment right then and there, for example, fillers, and we can lift the upper face and, give you your cheeks back. And so they see that instant result and are like, wow, why didn't I come in sooner?
Oh, right now that you said cheeks, do you guys do that? It's the injected for the double chin.
Kybella.
Kybella, there you
Yes.
go. So Kybella's always been really, really interesting to me, just because I see that it takes a while, right? Like it's not immediate gratification.
Correct.
And doesn't it get like really swollen at first?
Yes.
How long does that last?
So I usually tell people that last more so about 1 to 2 weeks. In like the super initial
So
swelling.
like a hippopotamus.
So I tell people, you're gonna leave here and you're gonna feel like you got a bullfrog down here.
Oh my God.
But that like big bullfrog, like red, tender, swollen, will only last maybe a few days, and then over the span of the next few weeks, it will slowly go down. And so I have you come in and we do a consultation because not everybody is a candidate. So we have to look at skin laxity. Because
I was gonna say
I can't just inject you and then, if your skin doesn't bounce back, I'm not trying to give you turkey neck.
Oh my God. And we have another set of issues at that point.
Exactly.
Like you're going to be invited for Thanksgiving and it won't be to eat. Okay. So that's my next question. So how old is like too old, or what are you looking for in terms of like skin elasticity?
Honestly, I do something called the pinch test. And so I check each individual's patient skin laxity and how it bounces back. There's no really cap like as to what age, but I probably wouldn't go past 50s, but it really depends person to person. So I've had young girls come in like in their 20s to do this, and I've had people in their 40s and 50s.
And so it swells up and then that goes away. And then, so it takes the 2 weeks for the swelling and everything to happen,
Majority. And then I usually tell people this process is about 6 to 8 weeks before you can come back and get a consecutive treatment. Because though we inject it and it dissolves the fat cells on contact, it takes about 6 to 8 weeks for your lymphatic system to drain all of these fat cells that are just hanging out over here.
Oh, gross. That sounds nasty.
You pee it out. You don't even know.
Don't worry. You pee it out.
So we do, we have that waiting period, essentially. And I tell people, hey, use the gua sha, use a chin strap, whatever you got to do to help with that swelling, and it'll help push it along.
Oh, that's so cool. Why don't people do Kybella for other places?
We actually do.
Okay. Okay.
But it depends, you know, it
Has to be
depends.
small areas.
It depends monetary wise too, what people are looking for, right? So I've done some hip dips. I've done people with like the bra fat back here. I've even done people not only double chin, but like their jowls, and they're like, I'm just like extra little cheeky down here. Let's take care of that. So there's a lot of places you can put it.
So that works for the gels too? Because, girl, I just turned 40. Like, we got to start looking at this stuff. I remember the first time I noticed, I was visiting my parents, right? And everybody's always told me, you look like your dad. So I hadn't seen my dad like in 6 months or whatever because we moved over here and I just couldn't go and visit. They live in Baja. And so I go and my dad's like this and I see the gels and I'm like, oh, that's where I'm heading. Oh my God. I love my dad, but God damn it, I don't want to look like him. You know, but I didn't know that you could do that for gels also.
Yeah, definitely.
Like
There's
smile lines. Well, those are fillers, right?
Yes, usually. Yes.
Oh, that's crazy. Do you guys do any of the what was that thing that was really popular? The fat freezing, not biofreeze. It was where it's not lipo, but they freeze your fat and a bunch of.
Oh yeah, no, we don't offer that type of laser. We have more of like the skin resurfacing, more of the skincare type lasers, not so much like the body contouring.
Okay, so it's more face stuff. Okay, so then for the Botox, you guys also do. I assume you do like hypohidrosis and then or hyperhidrosis. And all the things, migraines and stuff?
Yes, definitely. So a lot of people don't realize excessive sweating, which is hyperhidrosis, can be treated with Botox. So it's usually anywhere from about 50 plus per armpit, or we can do the hands, or we can do the soles of the feet.
Crazy.
There's a lot of places you can put it, yeah. And then for migraines, you mentioned, so some people may clench and grind their teeth and wake up with jaw or, head pain or teeth pain. So we can actually inject your masseters to help with that. So it kind of decrease that muscle tension and the contraction. And the nice side effect of it is it kind of slenders your jawline back there just a little bit.
I had been thinking about it, but I should probably just lose weight. Like at this point, I gained like 10 pounds and I'm like, well, why are my cheeks bigger? Like, bitch, like lose some weight. That's probably number one. So before you guys go over there with your like triple chins, maybe lose one and then you can get Kaiba in the second one.
So kind of bouncing off of that. So we actually do weight management as well.
Well, look at that.
Yes. So, hey, if you're trying to lose the extra 10 to 15 pounds, you're like, oh my gosh, Christmas weight, vacation weight, whichever. We actually offer compounded versions of semaglutide tirzepatide.
And so there's been kind of an argument, right, about which one is better, because I know there's a few. You mentioned the compound, but there's also like Ozempic directly, which I know people aren't using as much anymore, right?
Correct, because a lot of insurance is kind of caught on, right? And they're like, well, everyone wants to use it for weight loss, and they don't necessarily have it have diabetes. So majority, like the Ozempic and the Mounjaro, came out for type 2 diabetics. So now that we were kind of using it off-label, insurances were like, no, we're not going to pay for that.
And honestly, like it's not that expensive, right? It's usually, I don't know, like $300-400 or something a month.
It depends. And so like if we were trying to get like the brand versions of Ozempic and Mounjaro, I've had my patients tell me, yeah, my insurance wants me to pay $1,000 or $1,500 a month. And I was like, that's nuts. So that's why, all these pharmaceutical companies and pharmacies started creating the compounded version, which is basically the generic version, which is semaglutide tirzepatide.
Yeah.
So they still have the active same ingredient and give you similar results.
Oh, that's cool. I know like a ton of people that are doing it.
Yes.
And I'm like super close, but I just gotta like not pig out and stuff.
So the thing is, these medications help with like the cravings, and basically tell you, hey, you're full, stop eating. So it's gonna help with the appetite. It's gonna help with the cravings. And when you come see me, we do like a full-on consultation. We see if you've tried things before, what's worked, what hasn't. We taught diet, exercise. It's just like a full-on package.
So what about like the skin elasticity too? Like you lose weight so quickly. Like does everybody kind of just go lax, or is that why you recommend exercising and stuff? Or
and yes, for sure. Because we're seeing people out there. Oh, I'm losing my butt.
Yes.
So big thing is making sure you're eating enough protein and getting some resistance training so you can keep your muscle, because yes, this medication is going to help with, reducing the fat loss overall, but it kind of leaches at that muscle just a little bit. So it's very important to keep that up.
And so when you lose weight with the, is it visceral fat? Is it just like in your stomach, in your ass? Is it everywhere?
It's essentially everywhere, but of course it's targeting more so the visceral.
Oh, okay. Because that was my question. So if people like me, I've had lipo.
Mm-hmm.
So I have very little fat in my stomach now. I just kind of like get swollen when I gain weight now. So for people like me, like where does it like, where do you lose it from? From
Everywhere.
your ass, right?
Yeah.
Or like,
but everywhere essentially. And what I tell people, it's a marathon, right? It's not a sprint. I want to get you there safely and cautiously, and so I titrate you up slowly, and once we get near your goal weight, I titrate you off slowly, and that helps with the losing too much too fast and the skin laxity.
so is it like if somebody tells you, let's call it somebody me. If somebody like me says, okay, well, I don't want to lose my ass though, because I paid a lot of money for it. So, so I come in and I don't want to lose my ass. Like, how do you go around that?
I tell people, make sure you're getting enough protein and you're doing your squats and your lunges, girl.
Oh, like this is why we have lipo, because we're so fucking lazy. But I guess you can't have it all.
Right?
It's a give and take. Like you can't have it all. You gotta just stop fucking eating. I call it my Texas weight. Like since I moved here,
Yes.
and I was okay the first year. In the second year, I was like, okay, well, 5 pounds. Like, and now I'm probably up like 10, 15 pounds. I just don't feel like getting it off right now,
Yeah.
But I probably should at some point. But then every time I kind of go back and forth between like taking the shots or not. And so when you do the shots, you just give it to your patients or do they come in?
So they usually come in, and it kind of depends person to person. The initial first time I will give you the injection, I'll kind of show you and what to expect. If you feel comfortable doing the shots at home, I give you the medication and you can do the rest at home. But I have had a few patients that are like, I don't want to inject myself. I'll just come here to do it, and that's fine too.
Oh, and then because it takes like 2 seconds, right?
Yeah, it's really quick.
So I used to work for a weight loss clinic many, many, many moons ago. And we did the ACG diet. Did you guys ever hear about that?
Yeah.
Well, you guys don't do it or anything like that, right? It was like a fad and people lost all kinds of weight and stuff. But I think it's mostly because you're paying for it. So you kind of like stop eating a bunch of crap.
Yeah.
But that's not a thing anymore, right?
Yeah, not so much.
Yeah, now people do less hormone stuff, more. What is this? What even is it, honestly?
So it's a medication. It definitely is a medication. And so it helps with the fat loss, but it also helps with people like, say, for instance, they have a higher BMI. And so it brings that down, depending on what we're trying to do. It helps with the pre-diabetics. It helps with the patient that has, say, high blood pressure, because we have the extra pounds or pressure, on our bones. And even like cholesterol. So it helps overall. And there's so many studies out there that these medications are actually cardioprotective for us in the future.
Oh, really? Oh, that's crazy. So like you may live longer.
Yes.
So get the Botox. So I was talking with a friend of mine and she mentioned I guess they're calling it her cousin is a nurse in Mexico, and so they call it baby Botox, where it's a bunch of little tiny units, I assume, like maybe half a unit, I don't fucking know. But apparently they do it in like certain parts of your face, and it ends up being like 10 units. Is that like a thing?
So it depends. So if, say, for instance, we're trying to help with rosacea, or even some acne scarring, or like sweating on the face, we can do what we call micro Botox, which is like the smaller units, and it's more superficial. So it'll help with like the skin texture because of that underlying musculature. But I would say more preventative Botox is how I usually, tell my patients. So if you say static lines on your forehead, which is like basically the lines at rest without like making movement, and you see those start to kind of come in and get more etched into the skin, that's when we should basically help soften that so they don't get further etched and creased into the skin.
So your answer is yes and no.
Yes.
So yes for certain things, but not necessarily for like the static lines.
So like we can do those for the static lines. So that was where I would start.
Okay.
The
Okay.
Yeah.
Okay. And so how early do people come in for the Botox now?
I've seen as early as 25, and onwards from there, honestly. I think, probably my youngest patient was 25. And it's different. Genetics, our skin type, how we're taking care of our skin. Are we putting SPF on our skin?
Yeah.
Are we moisturizing? Are we drinking enough water? All those things, right? They matter. So yeah, the youngest I've had is 25, and she had just lines at rest, and I was like, yeah, let's help soften those.
That's so crazy,
Yeah.
man. That sucks. That's like expensive over time.
But if you start, at that young age, you usually, as that softening kind of continues, you may need less
Yeah.
going forward, depending if you start, versus you starting in your 40s and you're like, oh crap, now I have to work backwards.
Let me ask you though, what happens? And I've read a few articles about this. Like, what happens if you start getting Botox, in your 20s, and now you are 50? Does that muscle atrophy and like you have more loose skin?
No, not necessarily. There's a lot of myths and things out there that are talking about that. But no, essentially what it does is just softens that muscle. So it's not like atrophying, but because you've done it for that long period of time, it's helping with not only the musculature underneath to soften and relax it, but it helps with the skin on top. Because say, for instance, our forehead, like it's a very thin layer, right? So like the muscle and the skin are kind of, it almost adheres together. So when you affect the muscle, it affects that skin on top, which is why you see
I hadn't thought about it.
that softening effect of those wrinkles.
Oh, okay. So, but it won't sag
No.
over time. Like it just kind of softens, like your muscle is still muscling.
Correct.
Okay.
Yeah.
That was my thing. And you mentioned myth and misconception. So let's talk about that. In the beauty industry, especially in my industry.
Yes.
I mean, I would say all industries, but the beauty industry, there's so many myths. And like, I remember, and I fucking bought into this, but remember when the gouaches, what is it?
Gua sha, yeah.
When they came out and everybody was like, oh my God, you can change your whole face. And my thing was, and of course, like I'm a normal thinking person. So my thing was, but how do you move a muscle? I get it for inflammation. And I get like you're moving fluid. I get in the morning where like shit is just sitting there. So like you move fluid back. Okay. But you can't really like move a muscle and like, oh, it's so tight because I moved the muscle. Like
No. And exactly what you said, like the gua sha is more for the inflammation or, people who have allergies and they're like, I'm puffy in the morning. So it helps kind of drain all of that extra lymphatic drainage that's just hanging around and detoxes your face in that aspect. And so sometimes, your face may look a little slimmer because of that. But is it actually moving muscle around or shaping your bone? No.
I know. And I remember, I don't know if you guys saw, but even Lizzo was doing it. And I remember like she was doing it all crazy. She was like kind of moving it around and a bunch of people were like, hey, I'm a professional. You need to slow down and do it this way. And I was like, is that a real thing though? Like it's not.
No.
I feel like it doesn't do anything.
No.
What's another thing that you've heard of?
Well, I've had a lot of my patients come to me lately and they're like, I don't want pillow face. Because they're interested in aesthetics, but they're just scared, right?
Right.
Because they don't know. Because they see celebrities or, people on reality TV with big old faces, and they're like, I don't want to look like that.
Yeah.
So honestly, what I tell my clients is, you have to stepwise approach, and everybody's treatment is different, and what we're trying to achieve is different. So that's why I have you come in for a consultation. You talk about your concerns, I make suggestions, and we make a treatment plan for you. Catered to you. But I usually tell them, go to an injector that's going to be able to tell you no if you don't need more. So if I've had patients come to me and they've had their lips done a month ago and they've had a few fillers before that and they're like, I want bigger lips. And I was like, yeah, no, I'm not doing it.
Okay, so that was my next question. So when I first started in the permanent makeup industry, like there's some ego in there, of course, and I also was very young. And so I was somebody would come in and they would want some crazy shaped eyebrows or like, can you literally draw eyebrows on my forehead? And I was like, no, I will not. Like you will be walking out of here with my name on your face. And so now I just do whatever, not because I don't care, but more so because like, who am I to judge your standards of beauty, right? So where do you fall in? So like if somebody comes in with like these gigantic lips, and I see them all the time, people can't even close their fucking mouths anymore. There's so much fucking filler. But I digress. At the same time, I look at those people and it's kind of like, well, you had the money to pay for that. You wanted to pay for that and you wanted to look that way. So I'm going to talk a little bit of shit, but good for you for doing whatever you want. So as a clinician on the other side, where are you in that space?
So it really depends, honestly. So like, say, for instance, the people that come in and they just got filler and they want more filler, we need to let that filler settle because it takes like at least 4 to 6 weeks for it to completely settle and integrate to your tissues. That's like rule number one. And then also, the more filler you put in there, your lip anatomy and shape can only handle so much. So then you risk complications such as migration, where people will have this like white mustache over their lip.
Yes, dude.
And it just makes them look puffier, right? Or we may even have like where if we've shoved so much filler in there, then you start having compressions of your vessels. You can get vascular occlusions from stuff like that. So definitely you don't want, not to have vasculature in your lips. And then it can, create inflammation, infection, and all sorts of issues. So it kind of, I lean more so on the medical aspect of it.
I was going to say, it sounds like you're medically safe. But if it's medically safe and you deem it ugly, will you still do it?
If it makes my patient happy.
Right? Like, I feel like a lot of us in the beauty industry got to throw like our own egos aside and just be like, you know what? You want to look like Marge Simpson, but your tissue can take it. And you want to do it. We talked about the risk and rewards of this. Like,
yes. And exactly.
Right?
So I tell them the risk and benefit of this. And if they still want to proceed, I, give them realistic expectations like this and this may happen, or this is what it may look like. And so at that point, I keep their decision in their hands.
Yeah, right? Like, I feel like, again, like, do whatever you want. Dude, like, as long as it makes you happy and you're not, like, doing some weird shit, like, do whatever.
Yeah.
Like that, remember... I think they call them the Ken.
Oh, the Ken doll.
The Ken doll, is it the walking Ken? The Ken something? His lips are like ginormous. They're so big.
Yes.
And so every time that guy is mentioned, or anytime I see an article about him, people are like, why would his doctor do that? Like, da-da-da-da-da. And it's like, well, shit. Like, apparently it's what he wants. And apparently, like, it's medically safe to do. His lips haven't exploded all over the place. Like, he's fine.
Yeah, so
But
I kind of tread
nuts.
the fine line with, okay, is it safe for me to do this for you in addition to, okay, you want to add more?
Yeah.
So, yeah, that's my take on it.
Yeah. And like, again, because I see a lot of, of course, we see a lot of women in the industry, the beauty industry. I see it all. So the progression of just adding a little bit or evening out your lips, the progression from going from like evening out your lips to you can't close your fucking mouth has been insane to watch.
Yes, for sure.
But these trends come and go. Do these people that get like huge lips, does they have any lasting side effects like down the road? Like if say they choose tomorrow or in 5 years not to do them anymore, what happens to the skin elasticity? Or is that not an area that stretches like that?
I mean, it can some, but not as much as some other areas. So essentially like the hyaluronic acid, which is what the fillers are made up of, it's like a gel form. They last anywhere from a year to a year and a half. So essentially your body metabolizes it after that and most of it's gone. So it just, kind of, most of it's gone after, so many years.
That's why you have to keep doing it, right? So I have read a few articles though in the last couple of years of him coming out that not all of it leaves the body, right? So they're saying that the blood-brain barrier is a certain type of nacro, whatever the hell, and the fillers are not. They're too small, so they're coming through and causing some either potentially aneurysms or harmful things in the brain. Have you read about that?
I briefly,
Yeah.
but the percentage of something like that actually happening is very small, if any. So like I said, hyaluronic acid is something actually our bodies make on their own. But as we start to age, it makes less and less of it, which is why our skin looks maybe more dull, and we're losing that lift and the elastin and collagen as well, right? So the gel form of the fillers, which is the hyaluronic acid that we inject, once the product is injected into that specific area, it normally lasts about a year and a half. But majority of the time, I mean, your body metabolizes it, so there's very small chances of us finding that small particle that will lead up to something like that.
And kill you. No, it doesn't happen.
No. If you inject it in the vessel, then that's another story.
That's another story. Right now you're talking about like hyaluronic acid, and one of the things that estheticians fucking love, like It's been a buzzword in the past 2, 3 years. Like hyaluronic acid is like the end all. Do you guys use hyaluronic acid like mask, or do you use like serums and stuff? I feel like it's
All
so
the above.
overused.
All the above. It just kind of depends.
Yeah.
Like personally, I use hyaluronic acid serum every morning and night.
Mm-hmm.
So we'll kind of talk a little bit more about this later. But I have like a skincare acne journey that I went through, and was on Accutane at one point, and
wow.
that really
That makes
dries
your
you
skin,
out.
yeah.
Really dries you out. So I was like, give me all the moisture I can get because I need it. So yeah, that hyaluronic acid really helps with hydration. It helps with some of that skin texture. And it really helps with even like the overall kind of inflammation and the redness that can sometimes happen during those type of treatments.
And you feel like that penetrates really well by just like putting it on top?
So I usually tell people, like, after you cleanse your face, on like a damp face, not completely wet, is when I would add the hyaluronic acid. And then after that, you can apply your serums and your SPF and your moisturizer and your makeup, or however your process is.
Oh, but you do have them apply the hyaluronic acid first.
First.
Oh, interesting.
Yeah.
Because
So
I
it
feel
can
like
kind of penetrate and get into the skin.
yeah, correct. It holds 1,000 times its weight in water. Like we all love that. We were all talking about the hyaluronic acid. Another thing that I usually recommend for people, and I would say like probably over 30, is Retin-A. Do you guys have like a compound version of it that you saw at your place? Or?
So we actually have Elastin, one of our skincare brands, have like retinols, creams or serums, if you will. So we have different strengths. And for someone, depending on the age, honestly, when we're starting or what their issue is, we have like a 0.05 and then a 0.1. So it just kind of depends on what we're looking for. And there are some products that will have similar ingredients to retinol that will help with, say, the puffiness or fine lines and wrinkles, skin texture, because essentially what that product does is help speed up cell turnover.
Right.
So we can bring new cells in and repair and all of that.
And what kind of treatment would you say is your most popular for anti-aging?
For anti-aging, I would say Sculptra.
And that is where you do what now?
It's an injectable, so it's technically like, I call it injectable collagen in a bottle.
Okay.
So it's organic. It's a vegan product, and it's an alternative to fillers.
Oh.
So if, a lot of what I've seen lately is because people are afraid of the pillow face or looking too much, is we're straying away from that, and we're trying to find more alternative options that are not fillers. And so this is an alternative for that.
Oh, how interesting. So what's the difference between the two?
So Sculptra is actually going to stimulate collagen and elastin. So it's going to help with the skin texture. It's going to help firm up your skin, give you a nice glow. Because like I said earlier, we're starting to lose collagen as young as the age of 25, and we're losing, a percentage or two every year. So really trying to work back that clock, and how I say, like, age gracefully is what our industry is going towards. And so, yeah, it's an injectable treatment, and essentially what I'm doing is like laying little seeds of fertilizer of collagen and stimulating your own elastin and collagen to grow. So with a filler where you may see instant results, with Sculptra, it's going to take you a few months before you really start to see the results, but it's longer lasting. So a filler can last you a year and a half, but Sculptra, there's studies out there that's showing that it lasts 2+ years.
And where do you guys use that? Like all over the face or like under eyes?
Technically, you can use it pretty much all over the body. So usually I do like the under the eyes, the face. I've done it for people's necks. I've done it for the décolleté. If you have the crepey skin, we can do it for like the arms, the knees. You want to help with the little cellulite dimples. You're like, I have a hip dip. We can put Sculptra in there. People that are like, I don't want to go and get a surgical butt lift, we'll do a liquid butt lift with Sculptra.
Oh, that might be something people want to look at, because lipo hurts. And this doesn't sound too awful.
It's a non-surgical option. So a lot of people, of course, they're scared to do surgery, and they're like, what can I do before I get to that point? So this is definitely a good alternative for that.
No, for me, I'm fucking lazy, dude. It's like, cut me up, suck it out, put it somewhere else, and like, let me wake up semi-beautiful. Well, you wake up ugly, but that's not my point. You wait a few months, and then you look okay. What is your average clientele look like?
Honestly, probably from age 30 to 60 is what I see the majority of. Of course, I see younger and older to that. And what I like that we're seeing this change in the beauty industry is now I'm seeing men come in for treatments, which is
Yes.
amazing.
Yes.
I'm
They
like,
have skin
yes,
too.
glow up, right? Like, stop using that bar of soap all over your
Yeah.
face and your body. We
If
can
it goes
do
on your
that.
ass, it doesn't go on your face.
Yes.
Maybe buy some skincare for like your face.
Yes. So whether it's
That's
taking
awesome.
care of the skin or like they're like, I don't like these crow's feet because then my eyes go away. So little Botox to start you off, and then they're start them on that journey.
That's cool. Do you guys do anything for like the instead of getting a blepharoplasty, like somehow lifting that? Because I know there's some stuff out, right?
Yes.
What do you guys do for that?
So we can actually do Botox for that.
Really?
Yes.
What?
So as we start to age, our orbital rim gets wider. It kind of gives us this heavy brow look. And some of it also plays into genetics and stuff, right? So there is the thing called brow lift where we can actually inject Botox under your arch of your brow and help lift your brow. And it helps open up your eyes
Crazy.
more.
Oh, that's cool. But you also
Yeah.
don't want to look all like
No crazy.
no crazy eyes unless you request it because you're in charge of your own body. You want to look crazy? Sure, let's do it.
Yes. So I asked people. So there was a trend a few years ago where everybody wanted arched eyebrows. Now people don't really want that. They call it like the abuelita eyebrows. And I was like,
girl.
so what do we want with our eyebrows? Do we want it to stay there, or do we want to arch, or do we just want to lift them? So yeah, I definitely take into account everybody's age and preference before we make a plan for you.
One of my favorite things, and I'll say favorite just because I refer a lot of my clients, or potential clients, I should say, over to you guys because for tattoo removal.
Yeah.
So you guys do tattoo removal also. How many bad brows are you seeing now? Or is it mostly like big tattoos, or is it like smaller tattoos? Is it facial tattoos?
Honestly, a mix of everything. Say, for instance, if someone's going into a new career and they're like, oh, I have to get rid of my tattoos on my neck or my face or anywhere on their body. Or, hey, you're getting a divorce and you're like, I got to take this name off, okay? So we got to
for real.
get rid of this. So, yeah, we have people coming in for that. And then we do have some people coming in for the brows. So whether they've done microblading and they're like, well, it's too dark, it's too thick, it's not what I expected it to be.
Yeah.
So there is a way that we can do that. We put like a patch over and we can help with that too, or pigment to lift. But the potential to that, or the cautionary, I guess, to that is sometimes it can affect your hair growth because it's technically a similar laser wavelength. So yeah, sometimes we have to tell people, hey, girl, you gotta shave your brows before we come in and do the treatment.
So like if they have hair, they have to shave their eyebrows off?
That, or we use like a little silicone gel that goes on
I've seen
top
that.
helps with that. But there's still that little bit of potential that, hey, we might have a little hair loss.
Wow.
So, kind of we play it by ear.
Yeah.
Per
Well, I
person.
mean, at this point, like if they're super bad enough for you to get laser, just like shave your eyebrows off. Like it's fine.
They'll grow back.
They'll grow back. It's fucking hair. It'll be fine. I feel like I've been doing permanent makeup for 14 years. So when I first started, I didn't see a lot of cases of corrections, which is what we call them, right? So somebody who has been previously tattooed. I would say 5 years into it, I started seeing more. Now, I myself have stopped doing corrections. I paid my dues. I did them for so long. Like, I am done.
Yeah.
The girls see corrections, we can still help you. But I just stopped seeing corrections because they just got really fucking gnarly. Like, there's so many people that I got into my industry, the permanent makeup industry, and they're fucking crooked. They're big. They're thick. They're dark. So you typically, I know it's like kind of all over the place, but would you say 5 or more treatments to kind of lighten it? Because you can remove it, but it's more of a lightening process, right?
Yeah, like it gets lighter and lighter over time because we're lifting that pigment essentially, right? So we actually go by this method called the Kirby scale. And that's how we kind of figure out based on your skin type, if you tan, if you burn, where on the body is the tattoo, how long has it been there, does it have more than one color, does it have extra shading, do you have scarring? We take into account all of those things before we give you an approximate, hey, it might be a 7 to 10 session or sometimes more. It really just depends.
Oh man. But also these people tend to go to like your tia's garage to get their eyebrows done, you know? At the same
Yes.
time, you kind of deserve to be paying for it. So don't be upset that it's like 20 fucking services that you have to get done because you went to your tia's garage. Like, this is what happens. And this is like a true story. I've actually heard of that.
Yeah.
Like there's this gal, and I only know about her because my clients tell me, right? They're like, oh, look at this crazy lady. So there was this lady who goes from town to town. Like I think she's in Atlanta, and then she's like in Seattle or whatever. But she works out of people's garages, right? So, and there's no, I mean, it's a fucking garage.
Yeah. How sterile is that?
It's not at all. So, and I'm seeing it, you know, and I'm seeing like she does lives and everything. She don't give a shit.
Yeah.
She does lives, and so you're seeing like all this blood everywhere and stuff. And I'm like, well, if somebody went there, they deserve to kind of pay for the laser removal later down the road. The laser, though, I will say, like, that's one of the services that I wish more people did. People are so scared of doing lasers.
Yeah.
Like I've seen it where they leave and it looks normal. Like their skin is a little swollen, a little inflamed. But I've also seen where it looks bloody and ugly. Is that kind of what happens?
Specifically for tattoos, yeah. I mean, I usually tell people it's going to be a little swollen and it looks, you know, kind of inflamed. Sometimes it may even blister or welt up. That's totally normal. What I tell people is don't go poking at them because you don't want to create scars.
Yeah.
Just kind of let it be. And, you know, just take care of it. Kind of like how you get a new tattoo. You want to baby it. You want to aquaphor and protect it, right? For those few days. Don't go out and go sunbathing the next day, or don't go dip into a jacuzzi that evening. Like, ouch. So your skin is going to be a little sensitive during that time. So, yeah, just take care of it. But, yeah.
Don't be in the sun and stuff.
Yeah, and there's some, like, as we progress, you know, as we get up into those later stages where we have just a little bit left and we're really trying to lift up more and we crank up the jewels, you may get a little bit of pinpoint bleeding, and that's totally normal.
Have you guys had clients or patients that come in from getting removal with saline and stuff like that?
Like removal of saline. Oh,
so
like
we call it a removal. So there's a few companies out there that do they teach us how to remove with a tattoo machine. And so of course if it's like basically getting tattooed with saline water over and over and over and over again. I have done it in my early times when I was like, well, you know, you're interested in everything, right? So like, I got to get every certification. So here I go.
Yeah.
And I did it a few times. And of course, it's good for somebody who had maybe they got tattooed 24 hours ago. But it's not good in prolonged settings. I do know somebody that does it and she'll do the eyeliner, which I think is kind of nuts. You know,
scary.
I know. So you guys haven't seen that, like somebody that comes in, because whenever somebody asks me if I remove, I'm like, I do, but I don't. Like I know how to do it. I'm certified. I've done it a few times. I have seen some results, but it takes way too fucking long, and I have to tattoo you over and over with salt water.
Ouch. Yeah. No.
Yeah, exactly.
Don't do that.
So it's more, I always recommend laser over it.
Yes.
It's
definitely a safer option.
Right. And it's safer. And I feel like if it does look bloody, it looks worse than it really is. Right. You create a scab and it's gone, and then that's it.
Yeah. Yeah.
What's the
Just heals
typical
over time.
process for that?
So usually, say for instance, they come in for the tattoo removal treatment. After we're done with that, and depending also how far in their treatment they are, sometimes when we're cranking up the jewels, of course, it can hurt more.
Yeah.
And you feel it more. So we offer like lidocaine injections to help kind of numb up that area.
But it's so fast though,
Yeah,
right?
it is. Honestly, it's really
Yeah.
quick, but it also depends like how big it is. So for someone that has like a big old thing on their arm and they're like, nope, I need some help. So yeah, we do the lidocaine injections, but yeah, it's really quick. We kind of put some silver gel on it, which is good for inflammation and to prevent like bacteria from gathering. And then I told people just kind of baby it a little bit with some silver gel or the aquaphor, or applying like even hydrocortisone ointment on there, because it can help with the itching, because sometimes when it's flaking off, they'll have like that itching.
Yes.
And the last thing I want you to do is itch it and scratch it and scar it.
And you
right?
can forget that you have it there, and then you scratch and you're like, oh shit, my skin came off.
So it definitely helps with that process. And I usually tell people that'll happen maybe within a few days after your procedure. And then we schedule you out for your next treatment about 4 to 6 weeks out.
Cool beans.
Yeah.
And then before we forget, you guys do have a special going on, or tell us about it.
So, for our first 10 callers that mention Manage Us That Beauty, will actually win a custom facial.
And so this isn't like your garage facial, okay?
No,
this is like a
definitely
really, it's not the garage facial. So it's, you guys are working with like high-end products and stuff.
Yes.
So
Yeah, so our
Yeah.
esthetician is basically going to do like a quick skin assessment and address your concerns and create a custom facial for you.
yeah, that's so cool. So if you guys want to try it out, like why not be the first 10 people? Where do they call? Where do they go?
So you can call us at 210-960-5222.
All right, guys. Well, that's it from me at Pink Maven Studios, and from Davida Medical and Aesthetics. So if you guys have any skin questions or anything, feel free to comment below. We'll try to answer. Obviously, I don't know all the things, but they're a good source of information. Injectables, laser, facials, all the good stuff.
Yes, for sure.
Okay, we'll see you guys next time.
Bye. Thank you for having me.
Yes. Dude, 55 minutes.
Oh my gosh.
I know. It did not feel like it, right?
No, we're totally having fun chatting.
No, that
and
is so
everything.
cool. Let me see. I don't want to fuck it up. Let me go tell my husband to turn it off.
Okay. I was like, I hope you're keeping track of time because I don't know where we're at. Okay, good. And I think what they did, you know how we had it stretched to 12:30? I think they scheduled the patient at 12. So I was like, okay, now I have to get back sooner. Yeah. How do you think it went overall? Good? Okay. Good. Thank you. Good. Yes, they were all blinking.
Purposely? It's fucking free. I didn't even push the record button, but I didn't want to mess it up. Do I push to the...
That one? Yeah,
Yeah.
hold it down.
Okay.
It's still
See?
red. It's red, right?
Yeah.